is a very simple arrangement of three bones. This bone's called the ilium, and this is the ilium on the opposite side. This bone's called the sacrum, and the bone at the bottom is called the coccyx. But it's more the sacrum we're concerned with. At the front, these two bones form across the pubic arch, and there's a junction there, so that is a joint. It's not joined. So if one of these bones misaligns slightly, it can also strain and give you pains and problems in the front of the pelvis. And what we're looking at is a joint that exists between the sacrum and the ilium, and it's obviously called the sacroiliac joint, and it's in there. And what happens when you walk is one of your pelvic bones rotates forward and the other rotates back. So that counterbalance can be explained with this model. And what you've got here is the geometry of the muscles is equal and opposite. So everything on the left is equalised by everything on the right, and also top and bottom. So it creates what we call a tensegrity, where there are no pulls in the body because the pulls are cancelled out by the arrangement of its geometry. So the walking hip will be something like this, one part going forward, one part going back, and revolving around this bone called the sacrum. And how it revolves around the sacrum is because of this little joint in here that we're talking about, the sacroiliac joint. Now if that joint slips a little bit, one leg becomes functionally longer, the other becomes functionally shorter. One of the iliac bones is left in this rotation and the other one is left in that counter rotation, and the sacrum is misaligned, which then starts to result in misalignment of the vertebrae and spine above. But the biggest thing that happens is that we start to get an adaptive spasm of this muscle here called the piriformis, and this is the sciatic nerve. Probably see here all the nerves coming out from the spine, feeding there to become the sciatic nerve. And when this muscle splints to stop the damage, it scissors this nerve here, and then you'll get problems all the way down the leg. So anything we can do to release the spasm in there and around the femur head and the sacrum itself is the purpose of the talk this morning. Again, this is the lumbar spine, of which there's five lumbar vertebrae, 1, 2, 3, 4, 5. This is the sacrum, and the iliac bone would fit on there. So we've got that junction there, the sacrum there, and the iliac bone revolves around it. Now when it makes part of its adaptive shift, what happens is that these ligaments, which are at the back of the head of the femur, so as we're sat, we can get right into the, sorry, it's this way around, as we get right in the back of the head of the femur, we can get those ligaments by putting the hand under the bone, feel the big bony part there, put your hand underneath, and basically what you're doing is you're resting on the chair and your fingers are working into those ligaments there. So basically what we're looking at is finding the top of this bone, which is this big prominently part here. It sticks right out, you can actually get hold of it, putting your fingers right behind it and underneath it like that. That places us there. Then I move from that fixed point, move the leg inwards, move the leg outwards, flex forward, flex back. You can rotate it and give them a little rub, and when we're finished, just a little flick like that, just flicking your hands away, and that just helps to retone those very important ligaments, because the alignment of that femur head is really important to the alignment of the stability of the pelvis itself. Here we're looking at a model of the lumbar vertebrae, so that's the bottom 5 of those. But what you've got here is the nerves coming out from the sides and the discs. Now what they've done is they've showed the aging process, and they've showed a little propulsion of a disc coming out the side. This is quite, this would be hazardous, this would need an operation because it's fully propulsed. What you've got here is a nice healthy disc, which is a shock absorber in the spine, and as we age they slowly get thinner, and also you'll notice the bone changes shape and we get morphic changes, which arthritic spares is what it's called, and also the hole which the nerve comes out of slowly starts to narrow to the point where it can actually impinge on the nerve, and this is called spinal stenosis. And these would show on x-ray, and then they've got to make an interpretation from that x-ray, the degree of movement you've got, the degree of pain, the degree of severity, and then they would do an operation if necessary. But stenosis is a very difficult operation because they've got to enlarge this hole around the nerve, and there's a great chance of nerve damage and things. So that's a big one there. And when we look at this model, we're looking again at the femur head here. They've made it go into a slightly deformed state, which is what it would be like with arthritic spares on it. And again, it doesn't have to be painful, but it shows part of the aging instead of a nice rounded femur head. And then this muscle coming down to the source comes from those 5 lumbars, and if we had the same pull of muscle on either side, we'd have the perfect guy rope for the tent pole. But if one muscle pulls harder than the other, which it does when we strain it or we have an injury, then one side isn't pulling as hard, so it now side bends the spine to the side of the spasm muscle, but because it's already on a curve, it causes rotation, and as we put rotation on the discs, we start to get one side bulging, one side nipping, and eventually that could degenerate to a propulsion of the disc. So the more we can keep the pelvis evenly balanced and the muscles on either side evenly mobile, then that maintains the whole dynamics of the body. And because the body is what we call tensegrous, that means that our bones actually float in a suspension of the ligaments and the fascia. That's a totally different concept of weight bearing, and so the more we can improve those qualities, the better and healthier our body will be, and much less pain. That's the biggest factor, less pain. So when we come to this part, we're looking at the piriformis, and there's also a very important acupressure point at about this point here. Now when we were looking at that anatomically, you've got to be able to feel, you've got the femur head here, which we already worked the ligaments, and if you work a little bit more in towards the centre of the body, you're pretty much on the line that you want. Just up a little bit, so you've got the femur heads there, and you're coming in like that, and you'll feel it'll be tender if you're starting to get problems in it. And so the point is just about there, and again you can use your subo presser to press in there, or your fingers, and work that away. So that's a very important point there to work.